Hey, hello everybody. Can you see me okay? Just walking outside enjoying this weather before it starts storming. So what's going on everybody on this Wednesday afternoon? Thought I'd get on here and see what's going on. Explain to everybody what's going on so they know what's going on, you know what I mean? I'm wobbly, you know, the medicine makes you real dizzy, and that's why I got a life alert. Push that button when you fall. Yeah, the reason I like them right there, because there's like a delay. Yeah, they sit there when you're on the ground with a busted ankle or busted head for like 20 minutes before actually somebody gets over there to help you. That's what I don't like about them. They just sit there and blah, 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 blah. But anyway, about this whole anxiety garbage, you know, around Halloween, I was in there for a high pulse rate. So the hospital, they gave me some IV fluids and monitored my blood pressure. It went down. So a week after that, it was high again, but it was like 180. So the hospital in there, the doctor says, I said, can you treat this? I said, it's been high like this for 24 hours. It won't go down. He goes, no. I just looked in the computer. You see a cardiologist in 12 days. We're just going to let him deal with it. You're just going to have to hang on to that 180 pulse rate for 12 days before you see a cardiologist. So I had to call my doctor to get a beta blocker to get it go down. I had to beg my doctor. She's like, they won't give you nothing? I said, no, they won't give me anything. Well, there for a while, every day of the week, I've been going over to the hospital because my heart has been going racing up and down and my blood pressure was high. When they seen it in the ambulance, they're like, oh, is that anxiety? I said, no, it's not. Cardiologist said it's inappropriate sinus tachycardia. So now they got me locked in the hospital as anxiety. They got it flagged in their system. Like if he comes in, it's anxiety for anything. So I went there 9 times and within 8 or 9 weeks. And I go in there with a high pulse rate and a high blood pressure rate, like 225 over 139. And they say, oh, it's anxiety. You'll be okay. You don't need no treatment. We see people in here all the time with a lot worse than that. So that's what I deal with. So every time I go there, I get flagged as anxiety. Then I go home with no treatment at all. They just rush me out the door, like they blew me off basically. So then my insurance company called. I said, okay, what's going on with this anxiety? I said, I explained to them it's not anxiety. The hospital just blows that off as anxiety. They said, okay, we're going to send a nurse to your house once a week. Well, I explained to her because she had anxiety in her computer too. I said, this whole anxiety thing's getting all the way out of context. I mean, it's not anxiety. And I showed her my heart monitor. I said, look, I'm wearing a heart monitor for 30 days. Will I be wearing a heart monitor for 30 days for anxiety? So then my insurance company calls. Then my other nurse called because I had 2 nurses. She's like, okay, we're going to send a specialist, an anxiety specialist. I said, it's not anxiety. Don't be sending no specialist for anxiety to my house. I said, I explained to them, see what this whole anxiety stuff started? And it's actually a heart condition. It's not anxiety. It's crazy. You know what I mean? I had an episode when I was sleeping. My heart was pounding so hard, racing. It was like 139, 159. It was just jumping up to 179, 189. Laying in bed, waiting, asleep. You tell me that's anxiety? Yeah, they rushed me to the hospital. Oh, how much Mountain Dew you drink today? About 2 liters? Oh, that's anxiety. You're going to go home. That's the way it is. Anxiety. I got sick and tired of it. I've been trying to get a hold of the hospital, tell them to take the anxiety crap out of their system. And they, I called like 3 times a day. They don't return my calls. You know what I mean? It's crazy. You know what I mean? It's crazy. So I figure I get on here and give you a quick update. What's going on? You know what I mean? Anxiety. Oh my God. I've been working on it to get it out of the system. You just got to keep on calling and pounding and paying. I wrote them letters. And insurance company's going to send an anxiety specialist to my house. And it's for a heart condition. I'm telling you, it's getting bad. I don't know what's up with all this anxiety crap, but it's getting way out of context. You know what I mean? It's unbelievable. They're going to end up killing somebody. Yeah, because I had an episode Sunday, and my nurse on call's like, go to the hospital, it's that high. I said, they'll tell me it's anxiety, and they'll send me home. She's like, really? I'm like, yeah, every time. Your heart rate is 180, and your blood pressure is 225 over 139. I said, yes, ma'am. I said, I'm laying in bed suffering. And I said, if I go to the hospital, it's going to be anxiety. And the ambulance will come and say, hey, We're not rushing you to the hospital. It's anxiety. You're not dying. That's what they tell me. So they don't turn the lights and sirens on. They drive there normal, and they say it's anxiety. So they got me locked in, and the ambulance drivers and the hospital, anxiety. Rush him out the door, escort him out the door. That's how they do it. They escort me out the door saying it's anxiety and you're going to go home. The last time I was there, as soon as I walked in there, in my bed, got on my bed, they're like, "You're going home." I'm like, "I just got here." They said, "It's anxiety. It's anxiety. You're going to go home. We can't help you. It's anxiety. You're going to go home." That's how it's been. It's been pretty nasty past 6 months, I'm telling you. It's just, I don't know what to say. You know what I mean? It's crazy. When they see that heart rate bounce up and down or up and down on the heart monitor, they swear up and down it's anxiety because it jumps like real fast. Like, you're like, what is that? That's got to be anxiety. How much coffee you drink? How much Mountain Dew you drink? About 3 2-liters? That's the way it is over there. So they got Placid in the system. If he goes in there for broken leg, just blame anxiety, don't treat it, and send him home. I did not get treated at all. No blood pressure medicine, no beta blocker to get it to go down. I walked in with a high blood pressure all 9 times and a high pulse rate and walked right back out, not getting treated. They blew me off 9 times over anxiety, and it's not anxiety. It's crazy, isn't it? But you guys have a great day, okay? Bye now. Let me know. Comment.